Good afternoon, everyone. Welcome to the Minnesota Transformation Initiative's quarterly training. This quarter, we are talking about embedding benefits planning into agency culture. So the Minnesota Transformation Initiative is a project that is funded by the Minnesota Department of Human Services to support transitioning people with disabilities from some minimum wage into competitive integrated employment. We do a number of things, including technical assistance for providers and training such as this, peer mentorship for people and families, and a number of other things. But we are the ones that are hosting today's training webinar. So for those who might have been following this quarterly training series may know that we base a lot of our trainings and our technical assistance around the 10 essential elements for provider transformation framework that was developed by our partners at the University of Massachusetts, Boston. So I just want to remind us again of this framework, how it ties into what we're doing here as we're talking about organizational transformation away from center-based and toward competitive integrated employment. Our topic today on embedding benefits planning into agency culture fits into a number of these 10 elements. And really like these three areas that you see up on the screen, it kind of fits into each of them in different ways. Under leadership focus and values, it fits under that agency culture that supports inclusion. Under the employment practices and community life engagement, it fits under customer focus and engagement, making sure that people are getting the information and resources that they need to pursue employment. And under infrastructure, operations, and finance, as you'll see during the training, it really fits under ongoing staff development, getting staff the training they need in order to support benefits. Planning conversations is incredibly important, and Beth, one of our presenters today, will give a lot of great information and resources about that. So I'm going to introduce our speakers and then hand it over to them to present. We have three presenters joining us today. Beth Grube, who is the Benefits Planning Coordinator at the Minnesota Department of Human Services, Nancy Wagner from YesWorks, and Robert Reedy from RISE is stepping in for Becky. So you'll see Becky's name on Robert's screen here. It was a bit of a last minute switch, but grateful that you could be here, Robert, to speak for us. So I'm going to stop sharing my screen, Beth, so that you should be able to share yours and you can go ahead with your presentation.
Okay, great. Let me see if I'm able to share. Hi, everybody. Thanks for having us. I am Beth Grube from DHS. I've worked at DHS for a very long time, and I've been the benefits planning coordinator for about 8 years. But before that, I worked as the policy lead for our medical assistance for employed persons with disabilities program. And that's really where I got into employment for people with disabilities and benefits, because when we were implementing that program, it really became clear we really needed some clarity on how work impacts benefits for people with disabilities. And so that work that I started, when I started it was back in 2000. So we've come a long ways, and we are excited. We're kind of moving now into just another sort of phase. And what we really want to clarify is that benefits planning is just what it says here on the slide, that it's simply part of employment conversations, right? A lot of people tend to think that, oh, benefits planning, that's something somebody else does. Oh, those benefit conversations, I can't have them. So sometimes benefits are the thing that could keep people from going to work, or from increasing their hours, or taking a better job. And so that's really what we want to focus on, is how do we ensure everybody's just able to have those conversations about benefits. And so making it part of the conversation. And I am not able to advance my slides. Hold on just one second. There we go. All right. And so what we want to talk about today, and I'm so thankful that Nancy and Robert are able to join us, because I will tell you what we've been working on with the Department of Human Services, and then they can give you their perspective from provider organizations that have actually embedded benefits planning into the culture of the organization. And so that's really what we want to talk about today, is how do you embed benefits planning and those benefit conversations into your culture. And so making sure, like I said, it's not something that someone else does. There are different levels of benefits planning as well. There are conversations that you have that are just kind of everyday conversations. And there might be some questions or issues that come up that are beyond what you can talk about or what your staff can talk about. And so making sure you have the training and the connections to know where to go for more information when you need it. So we're not expecting that everybody becomes experts at benefits, right? There are people who really, I'm a certified community partner work incentive coordinator. I love to dig into the details of benefits and really get those. And not everybody does that. And we don't expect everybody to do that, but to have that baseline of I can have a conversation about benefits, or I know the, how to start the conversation or where to go to get more information if I need it. So really talking today about how do you start off? And really that is to get the information that you need, get the training and the resources. And on this slide, and I don't know, Danielle, I'm assuming we can send it out if it hasn't already been sent out. The strategies for embedding benefit conversations is on the Disability Hub MN website, and I'll be referring to that a lot during my what we're talking about today. So we can put that link in the chat as well, I think, and I'll show you the actual site and where that is too. So that is that connection there. All right, so one thing we really want you to take away, if you take away nothing else, and we hope there's more than this that you take away, but if nothing else, these 5 key messages really are so important to the work that we do. So when we're talking to people about employment, knowing these things about benefits will help the conversation and help people be able to move forward with their goals toward employment. And so, number 1, work and benefits can go together. In Minnesota, now every single benefit that we have, every public benefit that we have in Minnesota supports work. They have rules called work incentives that help people go to work while they're working, keep their benefits while they're working if they need them, or get their benefits back quickly if they stop because of work. So work and benefits can go together. All public programs in Minnesota support work. Number 3, people who work earn more money than those who don't, even if their benefits change. So a lot of times people are so scared of losing their benefits or that their benefits might go down, but helping them understand when you work, you'll have more money because your earned income will make up for the amount if your benefit changes of your SSI or SSDI or whatever that is. So just really getting that embedded in what we're talking about, that people who work earn more money than those who don't. So number 4, benefits shouldn't be the reason someone chooses not to work. There might be a lot of other reasons. We all have reasons why we can't work sometimes, but benefits should never be the reason. With good planning and understanding, people can work, and benefits shouldn't be what stops them. Number 5, benefits planning helps people see how work is possible. So again, with good planning and that information, it is so powerful. It's been great to be able to sit down with people and to say, okay, here's what your income looks like when you're not working. And here, right next to it, side by side, is what it would look like if you went to work. And that's what excites me about benefits planning and talking about benefits, is to see those light bulbs that go off with people like, hey, I can have more money, I can work. So helping them work to their full potential, and also helping them be able to save money is what we want. All right, so we have some resources that I want to make sure you know about. We have the Disability Hub MN, so hopefully all of you already know about that, but in case you don't, their information is here. The Disability Hub is our local information and referral agency. Anybody can contact them, either calling them or going on to their website, disabilityhubmn.org, and doing a live chat. They can help with all sorts of questions about benefits, but also questions about where is my closest local accessible movie theater. I mean, all sorts of different things. So that's an important resource. And then we have the Disability Hub MN website, which I'm going to go to right now and see if it comes up on my screen. and get it moved over to the right screen so you can see it. And I don't know, Danielle, if you can throw this in the chat, that would be great, the website. So I wanted to show you on the disabilityhubmn.org website, there is the For Professionals area. And within that For Professionals area, we have different toolkits. And so you'll see the informed choice, benefits planning. We have a toolkit on work, a toolkit on housing, and a toolkit on youth and transition. So the one I'm going to show you today is benefits planning toolkit. So this toolkit is laid out for professionals to be able to help have the training and the resources and the information about work and benefits. So we have different levels of training. So level 1 is just basics. This is what people need to know. Everybody should know. If you're working with people with disabilities, whether you're a PCA, whether you're a family member of a person with a disability or a person with a disability themselves, whatever your capacity is, when you're working with somebody with disability, having a baseline basic information about work and benefits is great, and it's a great place to start. Level 2 is deeper. This is much more extensive information about each of the benefit programs and who's eligible, what they provide, how people apply, and then how does work impact those benefits. So each one of our disability benefits in Minnesota are up there. Medicare and medical assistance are coming soon. There's also an orientation to DB 101, which is DB 101 is a website that you can utilize to go and do estimator sessions, where you can put in information about the person's benefits and about the income that they're hoping to earn. So maybe I want to go to work and I'm going to work 12 hours a week, earning $18 an hour. What will happen to all my benefits? So that information is in there. And then also orientation to My Vault, which is a secure account that people can create for themselves. They can set that up and then store information in there. They can do planning activities and different things. So you can get information on that too. So I'm not going to go into those. Those are additional trainings, but you can go in and find those for yourselves in this toolkit. Also, there are different activities that you can do. You can see different resources and tools and applications and things as well. The benefit coach training is also in there, which is a certification that people can get when needed. But what I really want to show you is what I talked about before, the agency strategies. So how do we, from an organizational kind of standpoint, embed benefits planning into our organizations? And in the Get Ready section, there is a section called Agency Strategies. And in there, we just kind of, we heard a lot from MTI and some of the providers that they were working with when we were doing technical assistance, that some organizations really just didn't understand or didn't know how to move forward with embedding benefits planning into the organization. So this is kind of a guide for you. Not kind of, it is a guide you can use. If you have something different, that's okay. And Robert and Nancy are going to talk about what they did. But this lays out some outcomes to work toward, just talking about how things are embedded into the agency culture, for staff capacity, the communication, and then what is in it for participants, for the people we support. The key messages that I already talked about are listed here as well. And then down here, we have an area for supervisors. So how do you get started? As a supervisor, there's some things that you need to know to be able to support staff, right? So it talks about the steps and what do you do first? And then you can go to this Get Ready. There's a self-assessment, so you can get your own information and think about what you think about work and benefits. And then you can go through also the different levels of training, start with level 1, go to level 2, then assess, do you need a level 3? And it talks about that as well. One thing I really want to point out is this benefits planning learning community. So we now have a learning community that you can sign up for. And today we sent out our first newsletter. So those of you on it should have received a newsletter. If you didn't get a newsletter from us, that means you're not signed up for the learning community. And so I'm going to grab this and I will put it in the chat for all of you to go right now and sign up for the learning community. And so we have a newsletter that we will be sending out, and it'll just do things like update you on any changes, if there are benefit changes, things that happen, like recently MAEPD, this legislative session, the MAEPD program will no longer have an asset limit starting January 1st. So that's pretty exciting. Things like that we'll share with you in the newsletter. And then we'll also have a quarterly meeting where people who are working with people with disabilities and are interested in learning more or talking more with others about benefits can join. So that is in the benefits planning toolkit as well. And then after the supervisors, there's also staff training kind of planned. So here's what staff can do. We can talk about what all staff need to do and need to know, and then getting more into staff who are actually supporting people with disabilities in going to work and making those informed choices about work. So it gives you a little guide for that as well. So that is a very quick overview of the toolkit. I'm going to go back now to the slideshow. All right. And so for today's training and for what we're talking about, this embedding benefits planning into the work that you're doing, the outcomes that we're really hoping for and expecting are that your understanding of work and benefits is increased. As you go through these trainings, as you do these different things, you will have an increased understanding of work and benefits, and all the staff that support people with disabilities will as well. That you'll become more comfortable talking about benefits and work with the people that you support. That's really the goal, is just having that comfort level. Again, not to be an expert, to be comfortable, to just that if a benefit question comes up, it doesn't stop the progress that the person's making. And that you can provide accurate and effective messaging and communication around work and benefits. We have a lot of miscommunication out there, and so trying to get that resolved as well. And knowing what information, resources, and training is available for you, and then also for the people you support. So we have those toolkits that are for professionals, but on the Hub website, there's also a lot of information about work and benefits, and there are different places to point people to. So that is covered in those trainings as well. And then also that you feel equipped to address work and benefit issues. So knowing when you need more help, and when you need more help, where do you go to get it? So the Disability Hub MN is a website, and their phone number is available to anybody for any questions anytime that they're open. They're open from 8:30 till 5 every day, except every business day, except state holidays. So being able to get that information from them, or I think Robert will talk a little bit more about other resources as well. And then, so the outcomes for people that we serve, really they're very basic and something that we all want, right? So that people you support understand more clearly what will happen to their benefits as they make the transition to whatever is next. So whether they're going to work, or whether they're a youth coming out of high school and they decide to go to post-secondary education, or whatever they want their own place, and that will have effect on benefits too. So things like that, helping people understand all of that, and then just really helping to change the trajectory of their lives. That benefits don't have to hold you back, because if you're living on benefits and only benefits, you're going to be living in poverty. So us being able to help people understand how they can go to work and how that can change that trajectory is a really exciting thing as well. All right, so now I am going to turn it over to Nancy Wagner from YesWorks, and I will advance to the next slide after Nancy. Then Robert will talk about their process as well.
Hi, thank you for having me. This is fun, and I like talking about benefits. So I am from a small organization, and so I thought I'd tell you just a little bit about our background. So you have an idea of where we started and kind of where we've come from. We were established in 2014. So this is, I work with my husband. We developed YesWorks. We have one part-time assistant who works with us right now. we've had a couple of different configurations. We've had some part-time coaching or other staff as well, but right now it's my husband and I work full-time in the business, and then we have that part-time assistant. I didn't do this on a just as a thought. I had over 30 years of employment services experience, so I had some background in it. And my husband had over 30 years of sales experience, so we thought together we would be able to do this, and took the deep dive in 2014. Beginning in 2015, in January of that year, we started providing services through VR. We have focused on placement services. Our focus has always been on competitive employment. We don't do anything with sub-minimum wages or enclaves or contracted work, anything like that. Our focus has always been on single competitive employment placements. It was a busy first year, and by the middle of the year, we had to get CARF certified. We had run out of our limited use vendor contract, and so we applied for CARF accreditation and had our first survey in December of that year. We also became a ticket to work provider, which we still are. We work with the American Dream Employment Network as part of an administrative employment network. And then from 2019 until 2022, we provided 245D services through the waiver. Next slide. So I had some experience before. I had worked I hadn't worked in a WIPA program. I had worked in an organization that was the WIPA. And so I had some understanding about how benefits connected with work and the importance of that. And so from the very beginning, our business planned for benefit planning services. Either I would just get certified, or both my husband and I would get certified. And so we knew there was a demand. We had talked to VR. They wanted somebody, they wanted to increase capacity, basically. And so we knew there was a demand. We knew there was a lack of accurate information. It would sometimes kind of drive me crazy sitting in a meeting and people would give bad information, or so anyway, we really were very committed to accuracy from the very beginning. We also knew that it was a missing link for a lot of beneficiaries. They were afraid. They were afraid of losing their insurance. They were afraid of losing their housing. They were afraid they were going to be not better off working. And so that really felt like a missing link and something that we wanted to do. I became certified as a community partner work incentives counselor through Virginia Commonwealth University in February of 2016. And then in April of 2020, I did the benefit coaching through Minnesota DHS and got certified through that. Next slide. So in integrating this, it was really a company priority from the very beginning. We invested some money to train. We invested my time to train and develop skills. And this was a learning curve. A few years ago, it was a little harder, and well, I don't know, maybe I've just gotten better at it too over time, but it took time. I had been in the business a long time, and I was surprised at how little I didn't know. Also, we were very committed to accuracy. I wanted to be right from the beginning. I didn't want to give people bad information. And so that kind of caused me to check and recheck my work a few times to make sure I was giving information correctly. We also had support from our funders. VR wanted this service. They wanted it in this area. They wanted to increase capacity. And so as I was getting certified, they were willing to do some changes to our contract to be able to get those referrals and to get that certification finished. 245D is benefit planning is available in all phases of 245D. So you get paid to do this. It's not something that's just an add-on. It's not an extra requirement. It's something you get paid to do. And the 245D it's available in the engage, plan, find, keep phases. All of them, it's something that's embedded into that. We are also a ticket, like I said, we're a ticket to work provider. Our contract with them requires a certified benefits person. And so it is ingrained in that services law. Well, so I would say it's just really a piece of our culture. It has been a planned service, but it's been a gradual process. So in terms, we still do placement services. It's really the core of what we do. We have some other services that we provide, but it's all pretty much related to coming to that placement service as a competitive job. That's where we're at. As we get new referrals, there's a convenience about being a small organization because we get a new referral and I go downstairs and talk to my husband, my partner. So, you know, the question always is, are they getting Social Security benefits? If so, what kind? Are there other benefits they're getting that are going to be impacted? What is their work or earning goal? What does that look like? Where does that put them in realms of earnings for each month? And do they need a closer look? I would say any funder that we have had is more than willing to have somebody take a closer look at that. It hasn't been difficult to do. It's just a piece of what we do. And it's a good planning piece for people to know ahead of time what they're walking into. So it has dovetailed really, really well into placement services. If I have a placement referral that I'm working with, I can easily answer those questions. People have questions during our meeting times, or, you know, maybe they need something repeated because the stuff can be complicated. Sometimes you need to hear it 2 or 3 times before you really understand it. And so it's easy for me to do that. It dovetails really, really well with the placement services. We're finding too that the participants are asking for that information. I think they're getting smarter about it. They're asking, you know, what is this going to do to my housing? What is this going to do to my Social Security? Am I going to lose it? I have them calling me. They're, you know, I'll do a benefit summary and analysis for a person, and 6 months later, I'll get a call from them and say, you know, I'm going to get an increase in my wages. What is that going to do? And so they're following up. They want to know. They want to know what is happening. The counselors have welcomed the information. I haven't had anybody who doesn't want to know that. Sometimes they call me and ask questions too, or I'll get an email with a question about a certain situation. So it's evolving, I would say, but it's something that's been exciting to be a part of. Next slide. So a couple of challenges that I had as I started out, and I would say some of this has gotten much better, but there was a learning curve for me. I was working as a sole provider. I had some resources in terms of the federal benefits, but it was a little harder to learn some of the state benefits. Some of the changes on DB 101 are so welcome from my point of view. It's great to have that as a resource. I use it all the time as a benefit planner. It makes my life a lot easier, to be honest. And then there's some of that extra training now too. That's really, really helpful. The other challenge that I've had is because we are small, I wear a lot of hats. I can be the job coach one day. I could be the biller of services one day. One day I'm writing the strategic plan, and other days I'm doing benefits. So I can get pulled in a lot of directions, but that's okay. It still has maintained. We have maintained a priority to keep the benefit piece going. The positives is there's no turnover. I own the business, so there's no turnover. I think that can be challenging for some organizations. You take the time to get somebody trained or certified, and then they leave, and that can leave a hole in your services. It has been an easy integration with placement. They go hand in hand. I kind of can't imagine. I was in this this business a long time, and I can't imagine why we didn't do this a long time ago. The services and the information are invaluable to people. It gives them more confidence about stepping out and taking a chance to go to work. So I see participant knowledge base increasing. They're asking me about trial work periods now, and I didn't get that at the beginning. They didn't know what that meant. So I think it has come a long ways. There we go. The other positive, as I mentioned before, is DB 101. I think that it has really it is evolving too. It has really they are very committed to accuracy as well. And I had a chance to look at the first quarterly newsletter this morning. It's awesome. It's filled with really good information. So I'm excited to be a part of that as well. That's it.
Great. Thank you so much, Nancy. Sorry about that chat. I apparently didn't turn my chat off, but yeah, I think so. Really, that part that you talked about, well, all of it, but being just a natural part of placement, and that the referrals and when you first start off, just asking those set kind of questions of everybody and just embedding that is really great. So thank you. And I wanted to, as we were talking, wanted to have a small provider perspective. And now we'll be hearing from Robert Reedy, who is with RISE, and RISE is not small. And so I'll turn it over to you. Thanks for joining us.
Yeah, thank you for having me. So yeah, RISE is not small. We have locations throughout the Twin Cities and throughout greater Minnesota. And so making sure that people are trained in benefits and understand how benefits affect people has been a big consideration for us for a long time. I started at RISE, actually, this is my 20th anniversary this month, but it's my 34th year working in the field. So the question around benefits has been a constant conversation for me. It started off for people that have been around for a while with the Red Book, which was a very analog approach to dealing with benefits. And over time, it's evolved to the internet coming around, and then the Minnesota Work Incentive Connection, which really gave us some great training and resources, and DB 101. And, you know, in my career, it's just become, for us as professionals, easier and easier to become informed, but also for the people we support and their families to have that information at their fingertips. And we've already talked about a few of those, like DB 101, but the Vault as well is an incredible resource for people to keep their information. And if you hadn't have resource or training on that, I would highly recommend those because they are just incredible tools and have transformed the way we approach supporting people, because now people can have that information, they can own it. The Vault allows people to carry that information with them and keep it with them instead of it being housed with us as an organization. And it really allows people to not only be educated, but to own their information. And I think it's very empowering. So I'm going to talk a lot more about our process, but I really wanted to touch on just how the process has transformed so much, especially in the last few years. And thank you to everybody who's been involved with that process, because it has made things so much better for the people we serve. At RISE, we have kind of a tiered system, as you can see on our overhead. It's a little bit small, but I'll go through it here. We've identified over the years that some people are very good at benefit planning, and and it's for multiple reasons. They have the right mindset for it. They have an interest in it. They want to do it. And so what we try to do is we get everybody trained to a basic level, which is that tier 1 in our training. And so that is understanding what the benefits are, how the benefits might be affected by work, you know, some basic information about how work and benefits intersect. But it doesn't go deeply into all of the work incentives. It doesn't go deeply into all of that. What we want people to do at tier one is to know that there's more information. So this would be something that somebody who's starting off in a job and maybe they've been in the job for 6 months to a year, we really want them to be at that level. As they grow in their career and they express interest in it, we will start to advance them. And one of the ways that we do that is through the VCU training. And that is just a place where, and this isn't the WIPA training or the more advanced training. This is just an online training that goes into more detail in the work incentives. And again, it's not as advanced as some of the training that I'm going to talk about in a little bit, but it's a great training through VCU, Virginia Commonwealth University. Thank you. That breaks down all of the work incentives and allows people to walk through it and see how they work, and gives them more information so they're even better equipped to handle those conversations. So that's kind of a tier 2 level. And we like it if most team members can rise to tier 2 if they've been in their position for a year or longer. And then our tier 3 is the training through the Department of Human Services, and that's like the coaching level. And we heard about that a little bit earlier today, where people can go through the coaching level. They can get an in-depth understanding of how benefits and work are intersect. And not everybody gets to that level. In fact, what our goal is to have one person per team get to that level, so that there's always somebody that people know to consult with if they have questions. So we try to have them kind of interspersed throughout the agency and throughout the teams so that there's somebody there to answer questions. And then tier 4 is the highest level, and that is the CWIC training, which is through VCU. We have one person trained at that level now. She's the 4th person we've trained up to that level. And one of the challenges with the training people to that level is staff turnover. And I'll talk a little bit about staff turnover and just how that impacts us is just one of the challenges. But that 4th level is the same level of training that like the people at the work incentives connection get. It's very advanced. It's extremely complicated. We're not sending people through that regularly because of just the cost, but also the complexity that it has. It goes kind of beyond what we need. What we're very comfortable sending people through a more detailed benefit analysis with the work incentives connection. They do a great job. And so if we need that level of service, we have that option. We'd like to have somebody on staff who can answer more advanced questions on just a timely basis. Some of our programs, like our IPS program, which is evidence-based practice for people with mental illness, we need to do benefit planning with that program. And so just having timely information can be very helpful. So we do like to have somebody trained at that level on staff. So that's kind of our tiered system, and it's been working for us. I mentioned that staff turnover is hard, and that's especially been hard in these last few years. That's a big challenge for us. You know, we get people who are interested, they grow, they advance through these tiers. Our average tenure as an employment person is, a couple of years. And so they are just starting to kind of move up through these tiers, and then they're starting to look at career advancement. And so, we're constantly kind of moving people through this system, looking for advancement in the tiers, so that we have new people kind of trained and available to provide this support to the people we serve. In terms of how it benefits the people we serve, we've talked a lot already today about how it benefits people, but our organization is very invested in person-centered thinking and planning. And for us, being able to provide good benefit information is core to being a person-centered organization. If people can't make informed choices about how their benefits are going to affect them, they're not going to make good choices about work. And so they just won't choose work. A number of years ago, we did a research project for the Social Security Administration looking at helping people go off of their SSDI benefits. As part of that process, we contacted over 5,000 Minnesotans on SSDI and asked them if they wanted to go to work with support from our organization. And with that, we were only able to enroll about 240 people in that project. And so the number one reason that people didn't enroll is they didn't want to lose their benefits. And that is when you think about 5,000 people being asked if they wanted to get support going to work, and we got over 200 to sign up, that's a very small percentage. And that was something that was interesting to Social Security. They thought that they were going to get a lot more people signed up. The reality is that fear about benefits being affected is a major reason why people don't go to work. And we kind of all know why when we see what people go through to get on benefits. Getting on benefits can be quite an ordeal. And so the idea of losing those benefits is very difficult. And then so many of their support needs are based on those benefits. And so the idea of even losing those supports is terrifying. And so to be able to sit down with somebody and explain, look, here's the benefits you have, here's what your needs are, and here's how we're going to help you make sure that you have the benefits you need. And sometimes that can even include talking to people about getting their benefits through their job. People can go off of their benefits and go to work full time and get their benefits through work. And we help people do that too. But you can't do that if you don't have good information to share with people about how that process works. And so really sitting down with people and educating them and going through that process and giving them an opportunity to try and see how it works for them, and doing it sometimes multiple times, and working with families, because we all know families sometimes are as afraid or more afraid than benefits being affected, is also a really important part of that process. So for us, we've had to incorporate benefit planning from early on, even early in my career, carrying the red book around in my briefcase, until now, when we're using the really amazing tools that are available to us at our fingertips, either with a phone call to the Disability Hub or looking up the DB 101, we can do amazing things in minutes, which used to take us days. So I love where we're at in our system now in terms of being able to support people with these questions. And now it's just a matter of making sure that we as providers are educated and ready to provide the support to the people we serve.
Thanks, Robert. Yeah, that is so great. And I agree, just getting back to those key messages, again, not everybody needs to be a expert at benefits and know all the details, but just having those key messages, and like this tier that you're talking about, like all staff come in, right? As I understood it, I was talking to Becky, any staff that are hired get a base level of benefit information when they start off. So that is really, the first step is figuring out how do we embed that training and information that staff need. And so thank you. Thanks for sharing. All right, so we are going to open it up for questions. If you have any questions, you can feel free to either pop them in the chat or come off mute and ask them. And while we get ready to do that, I'm going to also go to the next slide and just let you know that we have some discussion questions for you to take back into your organization. and think about with if you're a supervisor, think about this with your staff, talk about it with your staff, think about it on an organizational level, and in the management area. All these questions. So how often do questions about benefits come up when you're supporting people in work? How comfortable are you or your staff about talking about benefits with people you support and their families? Do you or your staff know where to find answers to questions about work and benefits? We've talked a lot about the Disability Hub and about DB 101 and other areas. So, and then do you think embedding benefit conversations and benefit planning into the culture of your organization is a good idea? And do you think it's doable? So yeah, if anybody has any questions, I'm going to stop sharing my screen and you can feel free to ask.
Beth, there were a couple of questions that were dropped into the Q&A button on Zoom. The first one went in there when Robert was speaking, so I'm guessing that this is directed toward you. Are there incentives for the people on the teams who possess these credentials and skills? Oh, you're on mute, Robert.
Thank you. No, not yet, but that's a great idea. And we are looking at, compensation models as we're looking at our staffing challenges. And that is something that we could incorporate for sure. Yeah.
And someone also asked, what are the fees for these trainings?
Great question. They are free. So everything on the Disability Hub is absolutely free and it's available to anybody who wants to access it. So in that benefits planning toolkit that we put a link in the hub and in the agency strategies, all of those trainings are free.
I'm assuming that the other trainings that Robert had in their tiered system, like the VCU training and stuff, though there are fees for that, correct?
For some of them, yes.
The VCU training is also free. You have to apply to be accepted into it, and they have priorities. So like the WIPA people are the highest priority, and then I think Ticket to Work. But there's I know the first time that I applied, I didn't get in. I had to apply again and I got in. There's also a certification through Cornell University. And that one has fee. I think it's around 1,500, but I'm not for sure.
Right. The more advanced you get, the more expensive it gets. And for the most part, I think most where you're starting off is a lot of organizations, a lot of staff will need to start off at the level 1 training that's on the hub, and then kind of advance through there, and then think. Like Robert said, CWIC certification is the Community Work Incentive Coordinator Counselor, is really, really in depth. I'm also a CWIC, and it's a great resource to have, but one that most organizations don't have. So really just start with the basics and then progressing, like Robert said.
Another question. I'm a social worker and have clients that are afraid to accept a raise or pick up more hours for fear of losing benefits. Is there an organization I can refer them to discuss and make an informed decision?
It's a great question. You're a case manager. I'm assuming a waiver case manager. Let me read the social worker. Yeah. So a couple things. Yes. All our waiver employment service providers have competencies that are required, and which is part of why we're talking about this now. Having benefit conversations is one of those competencies. So any waiver employment service provider should be able to have a conversation about benefits with the people they're supporting. Also, the Disability Hub can help with benefit questions. So connecting the person or talking with the hub with the person. So if you're a case manager and you have questions of your own, you can contact the hub to get answers. You could contact the hub along with that person, or the person could call the hub or chat with the hub themselves. And then also, like RISE and YesWork, there are a lot of organizations that do benefits planning as well. And sorry, this is a long answer to a short question, but also on the case management side, now there has been new legislation that just passed this year that requires that waiver case managers talk to people about benefits planning and ensure that they have access and that they know they have access to benefits planning. And again, when we talk about benefits planning, I don't want it to be this separate thing, this other thing. It's not an individual service that a person gets. It's simply a part of our employment services. So as you're providing employment exploration or as you're providing employment development services, talking about benefits is just part of that. And then getting deeper into benefits if the person needs that.
Another question, is the RISE benefit coaching plan downloadable to the public or just RISE employees?
So I presume you're asking about like our tiered system. And that is in the handouts in the slideshow. And I think that's going to be shared with everybody. So that's what I would refer you to, I guess, that is the tiered system that we use, and all of the trainings that we use are linked in that and have been discussed today throughout the training. So yeah, it's available.
And what I would suggest, so Becky and I also talked about it a little bit. So this is RISE's plan, and it's a great one, and there are great resources in there. So that's also in there, but also in the benefits planning toolkit, that agency strategies, it also has like, here is an idea for staff and how to lead them through which trainings could be helpful.
And just to confirm, the slides will be sent to everyone who registered following the training. I see that there's another question or comment in here, a little bit of a long one. So wage reporting requirements, especially to Social Security, is another piece of the employment goal that people have often struggled with. I've experienced individuals who have ended up quitting work, even though work was very beneficial to them, due to the stress of the wage reporting requirements. I.e., if they report timely as they were required, SSA would adjust their benefit incorrectly, and then they were asked to pay back. And this happened numerous times, and they just couldn't manage the anxiety and stress to help manage this. Often, we do not have providers to assist people with the reporting piece of employment.
Yeah, that's a great point, and one that we hear often. So definitely helping people to be able to report their wages accurately to the agencies that they need to report them to is part of employment services, right? So you can't, it's not good practice to help people find a job and then not support them in that part of it. So that's an expectation, is being able to know how to connect with the agencies that the person needs to report that income to. And that's part of those benefit conversations and part of benefits planning. So if I'm an employment service provider, maybe I'm supporting somebody with employment support, and they have a question about reporting their income. I should be able to help them with that, connect them with the hub if that's what's needed. If I don't know, then I need to go back and find out and connect with the hub on that. Or if a person maybe isn't getting support, doing that up front, that's another thing, is being able to have those conversations and think about, oh, up front, okay, when you start working, you're going to have to know how to report your income. Let's contact all of your benefit organizations or agencies to find out what you need to do. So because there are different reporting requirements based on what benefit that you have, and there are different ways to report. You know, there's phone apps now that you can do wage reporting for certain benefits, and some benefits don't require you to report every month, others do. So knowing that basic information, and that's in that level 2 training that I showed you. I don't know if I have access to the Q&A chat to pop the link into, but I will. I'll grab the link so that you can go into the training where some of that information is in the level 2 training about what the reporting requirements are as well for the different programs.
can I just jump on there
Sure.
real quick?
Absolutely.
You touched on the apps that make it easier. That was a big one. That was a big change with Social Security for especially for people on SSI. Reporting income has gotten much easier for reporting because of some of the electronic reporting systems that they put in place. And from the question, it sounds like that person was describing some challenges with SSI and reporting income. And that's one of the areas that has been improved recently. And that's again where like people knowing those systems and having team members understand that there are improvements in that that can really make a difference in somebody's life. So I would really encourage you and your team members to check out those resources, because that has been a tremendous improvement for the people we're supporting, to be able to get that income reported on a timely basis, and also making sure that Social Security gets it and gets it to the right people, because we all know sometimes there's mistakes. The better way that the best way to report it is through that app, because it goes to the right person all the time and it really cuts down on errors. So I just want to put a plug in for some of these new tools that are out there. They're amazing.
And I wanted to say, yeah, thanks, Robert. I also wanted to say one more thing about that. It breaks my heart when I hear somebody say that they quit working because something happened with their benefits. I worked recently with a person who she was super anxious about going to work. She has mental health issues and anxiety. And I think if I had not been talking with her, she would have quit her job. So being proactive, that's the other thing, is making sure that you're proactive. And if we know people are anxious about benefits, having those conversations and reassuring them and saying, and having a clear list, and this is what you need to do, and these are the dates, is super, can be really helpful and powerful as well.
We got a lot of good questions today. Here's another one. When it comes to discussing a benefit plan and comparing income amounts, i.e. how much they receive versus how much they can make if employed, what would be a good database or resource that case managers can access to view the benefit income amounts that clients receive, including any housing, rental assistance? I find often that clients do not always recall their benefit amounts. Are there other resources besides calling economic assistance?
Yes, great question. So we in the vault that Robert talked about earlier, there's an activity that people can do. So they go in and create their own private, secure personal account, and then they can go in and request their own benefit lookup. So what that does is it's sent via chat, a secure connection with us at the Department of Human Services. And it's just a request for the person's benefits. They get it back themselves in their vault as a PDF. They can share it with whoever they want to. So it's a great way to confirm this is what the person is on. So, if you have other ways of doing that, you can certainly utilize it, but that is something that's available to the person. And the reason, we made it available to the person themselves so that they have it for whenever they need it. So maybe they're talking to their financial worker, or maybe they're talking to their housing provider, or maybe they're talking to you, their case manager, and they need to know what benefits they're on. They can log into their vault and go and find that benefit lookup. And so maybe in a future session, we can talk about the vault more and how that works, but I will. And Danielle, I just realized that all the links that I have put in are only going to the panelists and the host, not to all participants. So we might need to.
I see that. I'll recopy them and put them out to everyone.
Okay, thank you. I threw a lot of them in there. I'm going to just grab another link that has, we created a document for professionals to understand how to use the vault in the work that you're doing. So it just kind of gives a step-by-step. These are some things that you can do. And so I will grab that link too and put it in the chat. Which is going to take me a minute to do because it's buried.
Any other questions? If you prefer to talk rather than type, you can also click the raise your hand feature. And then that will alert me to unmute you so that you can ask your question verbally rather than typing it out. All right, I think that might be all the questions we have so far.
Okay. I can show you the vault page quickly since we have where we go and yeah, we have a little bit of time, right?
Yep.
Okay, I will share my screen again. And we're putting this link in the chat as well. So this is a page that talks about how to use the vault with the people you support. So again, it's on the Disability Hub mn.org website. It's in the For Professionals section, and it is in the work toolkit. There's resources, and it's in there. So the vault again is a secure private account that people can create. They just go in, like you can see I'm signed on right now. You go in and use your email address. And we've heard, well, some people I work with don't have email addresses. Well, they should. So that's how we communicate these days. And so you can help them create email addresses or get that set up. And then create a password, which keeps it secure. So they create their own password. And just like on any site, another question we get a lot is, well, people forget their passwords. You can reset your password just like you would on a banking app or any other app. And so logging onto my vault allows you to have the secure personal account where you can do different things, different activities. You can plan for work, you can plan for benefits, you can plan for housing changes, different things. So talks about how it can make your job easier. It tells you as a professional, you can use the vault to connect and collaborate with other people on the person's team as well. They can share contacts, so they can build a contact list. Maybe they have a voc rehab counselor, and they have a waiver case manager, and they have a special ed teacher, and they want everybody to be able to communicate. They can share that information. And then that secure storage of information is another thing that we heard a lot from people with disabilities. And when I was in the housing division at DHS, I heard a lot from people who were homeless that we don't have a place to store our documents. They lose the notices. Maxis notice comes out, and they don't know where it is. And they get a notice from Social Security. So all of that information could be scanned and uploaded into their vault, so they had it in one place. So there's a little bit video about my vault and how what it is, and then there are specific steps and guides. So how to create a professional vault account for yourself as a professional or your staff. This is how you can create an account. How to create contacts and store files. There's a little video on that. How to use my vault to help people plan for work, benefits, and housing. So there's a kind of step-by-step instructions and videos on what is in the benefits planning path in the vault, what is in the housing and in the work area. So that's all in there. And then there are some guides in here that talk about how to create a My Vault account. Very simple, quick activity. There's a PDF that you could take a look at, walk through with the person, or just share with them and let them create their own My Vault account. So that is there as well. And now my toolbar is hiding my, there we go. And so I'll just show you quickly what my vault looks like. So like I said, there's an area where you can go in and create contacts. And so the person, a lot of times people have a lot of people on their team. They could go and create contacts, put in email addresses, they can put in phone numbers, contact information. There's a section where you can save files. So those notices that they get, again, they could upload those here, their benefit lookup, the things that they do. And then there's also an area where everything everything can be shared. And so it gathers up what have you shared with other people. And then in the planning paths, and this is what I'll show you, we just added the best life path so people can plan to have their best life. There's a path for planning for work. And here's the benefits planning path. So this is what I'm going to show you right now. In here are the activities that you can do. Starting a benefits plan, figuring out, am I in the right place? What do I want to learn? Get a benefits lookup is something that we just talked about. If the person doesn't know, I mean, that in having benefit conversations, one of the first things you need to do is make sure you know what benefits the person actually has, how much they are. And so clicking on that will bring you to a page that talks about what it is. You click on the next button, and then you just start entering. The person would enter their own name. They'd be logged on to their own account, their own first and last name, their date of birth. They can click on send a copy of my results to a counselor and put your email address in there if they want to share it with you. And then they have to give us their one other piece of information. Usually it's their address. And when they click on next, just says, yep, I'm requesting this for myself. You can't request on their behalf, and they sign it and they submit it. And then that comes in to our response team. They go into our administrative systems, they look up what benefits the person has, put it into back into the vault. It's sent back securely, and it goes into the person's vault. They get a little notification up here. It would say your benefit lookup. It would show a notification, and then they click on it to get their benefit lookup. So that is a really great feature of the vault. And then there are other things like doing a budget. Okay, I know about my benefits. What about the rest of my income and expenses? Making a work plan. This see how work and benefits go together takes you to the DB 101 estimators. So hopefully a lot of you know about them already, but DB 101 is the other website we have that you can go in and actually put in, okay, like I said before, maybe I want to work 20 hours a week at $15 an hour. What is my income going to look like? What are my benefits going to look like? And that these estimators, so there's a benefits and work estimator, a school and work estimator, which is more simple, and it's for youth who are generally people who are under age 26. Excuse me. And then there's the MAEPD estimator, which just helps people figure out, in Minnesota, one other message that I have said a lot is in Minnesota, it is impossible to lose your benefits or to lose your medical assistance because you work, simply because you work. There are lots of other reasons that you could lose it. But, with MAEPD, people are able to work and keep their healthcare coverage. So, so there are a lot of resources on the Disability Hub MN webpage, and we're connected with DB 101. So you can get to that through that. So.
That there is a question about MAEPD that came up. When individuals are transitioning into the employment services, do a lot of them need to change from the medical assistance they receive from straight MA to MAEPD or medical assistance for employed persons with disabilities?
Yeah, a lot of times they do. Some things, policy changes have happened. I'm going to stop sharing my screen here. Policy changes have happened in the last few years where the income limit for a spend down has been increased. So, which has been great. So, it used to be that people would be on a spend down, MA with a spend down, where they would have to pay the first portion of their income before MA would start paying. And that having MAEPD was huge because a lot of people had huge spend downs, a few $100s a month. And so the MAEPD premiums are much lower than spend downs generally. So yes, when somebody is on MA, if they're on free MA, if they go to work, their income is going to increase. And so being able to talk to people about that, like, yep, your income will increase. You might not qualify for free MA anymore, but you will qualify for MAEPD with a spend down. And then comparing like, oh, well, you'll have a $35 MAEPD premium, but your income will go up by $100 or whatever it is. And being able to really point out that you will still have more money is important. So yeah, people do, especially with healthcare, they do switch benefits when they go to work very often.
All right, any other final questions? Again, either drop it in the Q&A box in the chat or raise your hand and you can unmute. Beth, did you have any final slides, or is that wrapping up your part of the presentation?
Oh, let me see. I bet I do. Yes, I do have a couple more. I got so wrapped up in just having a conversation that I forgot we still have a presentation to finish. Yes, so if let me do the slideshow, see if it will cooperate. Sorry, it's not going to cooperate. So I'm just going to do this. So thinking about where do you start? So first off, again, providing those positive messages and making sure that people that you support really have the information and accurate information about work and benefits. Using those 5 key messages that we talked about before, using that agency strategies link to go through and really figure out, okay, where am I at with my agency? And if you're a waiver case manager, helping the providers that you're working with know that these resources are out there, and holding that up as an expectation that benefit conversations are part of services. All right. Also, making sure you and your staff know about the disabilityhubmn.org website and can access it and know how to navigate it. And then also the people that you support, making sure that they know that it's available. And so one thing that we have heard a lot is youth in transition, having that resource ongoing as they enter into adulthood is huge. And then join the benefits planning learning community. So I put that link in the chat. You also will have it here. It talks a little bit about what the benefits planning learning community is. So those are some of the next steps that you can take in embedding benefits planning into your organizations. And the Disability Hub information is here, and then my contact information is here as well. So I just thank you all so much. I'm going to stop sharing my screen. Thank you for joining us. It's exciting. And if you have questions, need help, always contact the Hub, and you can contact me directly as well.
Thank you so much to Beth, Robert, and Nancy for joining today to talk about how to embed benefits planning into your agency. I think a lot of great information shared here today, a lot of great resources. And like I said before, the slides for this training will be going out to everyone who registered. The recording of the training will also be made available once we can get it captioned and whatnot. It'll go up on our website and available to everyone as well. So just to wrap up, a couple quick reminders about some other upcoming training opportunities that we have. This was MTI's quarterly training. Our next quarterly training will be November 16th from 1 to 2:30. We're still working on nailing down the final topic for that, but the registration for that will be up on the MTI website, which is on this slide. I'll also drop that in the chat as well, so you can access that. But that's how you can find all of our upcoming trainings. You can also watch for an announcement in DHS's e-blasts that go out on Tuesdays for that upcoming training as well. Also, a save the date note here. On October 12th, MTI in partnership with Minnesota APSE will be up in or down in Mankato, and then up in Brainerd on October 19th. We'll be doing trainings from 10 a.m. to 1:30, and both of those. And these trainings are geared toward direct support staff at organizations that historically have been center-based and are looking to really open up and to do more community-based supports. And like I said, geared toward direct support staff, getting them thinking about what can it look like to be delivering these services in community settings rather than center-based settings. A little, benefit for that is that lunch is included. So this is just to save the date. Registration will be made available soon. You'll be able to find that on Minnesota APSE's website, MTI's website, and we'll make sure to send that out through various channels as well. So that's another thing to watch for. Last thing, if you could please take a quick survey. I'm also going to add, I guess I can't add this in the chat right now while I have my slideshow up, but I'll stop sharing my screen in a second and drop a link in the chat for a really, really quick, like less than 5-minute survey. That gives us better information about what types of trainings are beneficial to you all as we continue to plan for future quarterly training. So please take a moment to fill that out. I'm going to stop my share so I can drop a link to that in the chat. But otherwise, that wraps up our training today. Thanks again to our presenters. Watch for the slides and the recording that'll be coming into your inbox. And I hope everyone has a great rest of your day.